student. Can you guys hear me well?
Yeah.
Okay, so welcome to your first PAL session of this year. If you don't know what PAL is, it's called Peer Assisted Learning, and it's provided by G&D, and it's a very valuable and efficient tool of learning for you guys, so you should definitely make use of it. Before I start this session, if you want to actually benefit, you have to be interactive, because if it's more of an interactive session than a lecture. And in order to make sure you understood, you have to interact. So at any time, you can open your mic and feel free to interact. So in this session, inshallah, we'll be discussing fluid distribution in the body. And then we'll also be talking about how to measure this fluid distribution in different fluid compartments. And then for the main part of the lecture, we'll be talking about osmolarity and movement of fluid. And finally, we'll be talking about Datet diagrams. So something to know about Dr. Abdul Ahad's lectures is that he puts in a lot of information, and half of it isn't going to be examined about. And he repeats a lot of concepts. So inshallah, in this lecture, I'll try to highlight the concepts that he asks about a lot and the concepts that you'll be using in your future lectures, inshallah. So let's start with fluid distribution in the body. So as you know, the body fluid makes up 60% of the body mass. So 60% of your body is made of water. And this 60% is divided into extracellular fluid and intracellular fluid. So the fluid outside the cell and the fluid inside the cells, okay? And so the intracellular fluid forms 40% of the 60%, and the extracellular fluid forms 20% of the 60%. And the extracellular fluid is further divided into interstitial fluid and blood plasma. So interstitial fluid is the fluid between the cells and the capillaries. And so another name for this would be tissue fluid. And the blood plasma is obviously whatever is running in your blood vessels, okay? And the remaining 5% is transcellular fluid. It's insignificant. This is the fluid in your synovial joints, in the peritoneum, in the pericardium, and so on. But this is insignificant. So ECF is mainly interstitial fluid and blood plasma, and intracellular fluid is obviously the fluid inside the cells. So out of the total water in the body, which is 60%, 60% of the body mass is water. So out of that, 1/3 is ECF and 2/3 is ICF. So if we divide 20 by 60, we'll get 1/3. And if we divide 40 by 60, we'll get 2/3. Okay. So knowing that, a person who has ingested 3,600 milliliters of water, after the equilibrium is reached, calculate the amount that will be present in different body compartments. So you're not supposed to see the answer. So 3,600 milliliters, how will that be distributed in ECF and ICF? Does anyone know?
Can you repeat the question, please?
So 3,600 milliliters of fluid were ingested. How will that be distributed between the ICF and ECF, knowing that ECF makes 1/3 and ICF makes 2/3?
What's the volume again?
3,600.
So we can do 1/3 to 1/3 into 3,600, the ECF.
Okay, and
2/3 out of 3,600 to get the ICF.
excellent. And what if you want to find interstitial fluid?
Interstitial fluid.
Yes.
Out of the ECF, the value we find for the ECF, we can do 75 divided by 100 into that value to get the interstitial fluid.
Excellent. And blood plasma?
Blood plasma will be 20% of that, 20 by 100.
Excellent. It's just as you said. ICF will be 2/3 times 3,600, which is 2,400. And ECF will be 1/3 times 3,600, which is 1,200. And out of that, 3/4 or 75% is interstitial fluid, and quarter is will be in the plasma. So is this concept clear for everyone? So this is a concept they can
Yes.
ask you.
Yes.
Yeah.
Okay, so now let's move on to the next concept, which is the measurement of fluid compartments. Okay, so how do we actually measure these? So you see these two slides, they're filled with information, so cramped. This is not important. You won't be asked about this, most probably. And it's information that you won't be using in medicine. Okay, so what's important from these slides to know are the dyes. Okay, so this is asked about quite a lot. So I've highlighted here, this is just pure memorization. So I highlighted the ones that have been asked about before. So he might repeat one of those. So make sure you know those at least. Inulin for extracellular fluid volume, radioactive iodine plus a protein and plasma for plasma volume, and for total body water, radioactive water. Okay. So we use these dyes to measure these fluid compartments. Is that clear?
Yes.
Yes.
Now the methods you don't need to know. Okay. And so we have those, and I don't see intracellular fluid. So how do we calculate intracellular fluid if we don't have a dye for it? How do you think?
ECF minus plasma volume.
Again?
ECF minus plasma volume.
That's for interstitial fluid, صح? So what about intracellular fluid? So it's important not to
Total body
confuse
water
between
minus
interstitial.
extracellular fluid. Total body water minus
Excellent.
extracellular fluid.
That's correct. So Rumaisa, do you get why your answer was wrong?
Yes, thank you.
Okay. And for interstitial fluid, as she said, it's extracellular volume minus plasma volume. So does everyone get this concept? It's basically because the total body water, you have it from radioactive water, and then you get the extracellular volume from inulin, for example. And then to get the intercellular fluid volume, it's just the rest of it, right? So total body water minus extracellular fluid volume. And for interstitial volume, you have the extracellular fluid volume from inulin, and then you have the plasma volume from this, and then you get interstitial volume. So all clear until now?
Yes.
Okay. So now let's move on to the second important part of this part of the lecture. The conditions for indicator dilution method. So in order for an indicator to be efficient, it needs to fall under these four categories. It needs to rapidly equilibrate in the compartment. It needs to disperse evenly throughout the compartment. It needs to disperse only in the compartment that's being measured, and it's not metabolized or excreted. Now this fourth point has been asked about 2 times before, so he might repeat it. So he'll tell you the indicator should fall under which of these categories in order for it to be efficient. And one of the options would be either it's not metabolized or it's not excreted. Okay, so this is how a question on this will come. And so basically, and the explanation for these in the methods, they put in the indicator and it disperses in the compartment. Okay, and in order for it to be a good indicator, it needs to disperse in the compartment quickly and evenly, and only in that compartment you want to measure. So if you want to measure the blood volume, for example, you need an indicator that only disperses in the blood volume and not anywhere else. So that's basically it. This is the main one. It's not metabolized or excreted. Obviously, you don't want the indicator to be broken down or excreted, because then you won't be able to measure the compartment accurately. And this is the one that's mostly asked about. Okay, so is this point clear?
Yes, it's clear, but can we find this anywhere in the slides?
Yeah, it's, let me show you. It's over here, you see. The following conditions are satisfied, these 4 points.
Oh, okay, thank
The
you.
fourth one is, I mean, So now another slide that's not important. This will be important for renal probably, but right now you didn't take enough information for this to be important. So this is for the measurement of blood volume. This equation is used. Total blood volume equals plasma volume over 1 minus hematocrit. If they were to ask you about this, that they will give you the hematocrit value and the plasma volume value to get the total blood volume. As I said, this is not important for foundation. He probably won't be asking about this for foundation. Okay, but the only thing that's beneficial from this slide anyway is this equation. And as I said, it will probably not be asked about in foundation. Okay, so now let's get into the main part of the lecture, and this is important because this concept is going to be following you all throughout medicine, not only in foundation. In renal, GI, CVP, all the other blocks, you need to know this concept very well, and it needs to be second nature to you because you'll be using it a lot. Okay, so it's the concept of osmolarity, osmosis, and the movement of water in body compartments. So first, let's talk about osmosis. So what is osmosis? Osmosis is the net diffusion of water across a selectively permeable membrane from a region of high water concentration to one that has low water concentration. Okay, so I'll repeat, it's the diffusion of water across a permeable membrane from a region of high water concentration to one that has low water concentration. Okay, and in other words, we can also say that water moves from an area of low solute concentration to an area of high solute concentration. Okay, so in this diagram, we have a lot of water molecules here. We have water with a lot of solutes. So osmosis is the movement of water from here to here. See, here we have high water concentration, and here we have low water concentration. So water will move from here to here. Or in other words, we can also say that water moves from an area of low solute. So here we have no solute, and here we have a lot of solute, NaCl, and so water will move from here to here. Is this concept clear? It's very important.
Yes.
So now we have another important concept, which is osmolality versus osmolarity. Okay, so these look very similar, but there's difference. Okay, so osmotic, first of all, we need to know what osmotic pressure means. Okay, osmotic pressure is the effect of a particle on the movement of water. So it has a different definition in your slides, but this is just a simple way to understand it. In the slide, it's very complicated. Okay, so osmotic pressure is just basically the effect of a particle on the movement of water. So how much the particle affects the movement of water. Okay, and we'll understand more soon. So the total osmotic pressure does not have to do with the size of the particle, but with the number of particles. This is very important to know. Okay, and we'll see why in a minute. So osmolality is a measure of size, and osmolarity is a measure of number. Okay, and we said that osmotic pressure has to do with size, with the number of particles, not with the size of the particles. So that's why, which one do you think is more suitable to use, osmolality or osmolarity for osmotic pressure?
Osmolarity.
Osmolarity. Why? Because we said that osmotic pressure is has to do with the number of particles. It doesn't have to do with size. Size doesn't matter. Just the number matters. And so osmolarity is a measure of the number, okay? But osmolarity is a measure of size. And therefore, we use osmolarity to measure osmotic pressure, okay? And we'll see why this is very important in a minute. Now, water moves to the area with a higher osmotic pressure, okay? So now let's try to apply this in the diagram we already took. We said that osmotic pressure has to do with the number of particles, صح? And so here we have more particles, more NaCl, and therefore this area has higher osmotic pressure, and therefore water will move from here to here, which is low osmotic pressure, to high osmotic pressure. Is this point clear?
Yes.
Yes.
Okay. Keep this point in mind too, because we'll be having a quiz on it soon. Now, mole, you see mole over here. This is a measure of osmolality. And osmol is a measure of osmolarity, okay? So this is a measure of the size, and this is a measure of the number, okay? So 1 mole of glucose equals 1 osmol of glucose, but 1 mole of NaCl equals 2 osmols. So why do you think that is? Why do you think?
NaCl dissociates into Na plus and Cl minus, so we have two osmotically active species.
Excellent. Did everyone understand that point?
No.
Yes.
Okay.
So is it because
So
we have two different molecules, it's going to be two osmos?
Yes, excellent. This is because NaCl dissociates into two ions in water, and therefore 1 mole of NaCl has a higher number of particles than 1 mole of glucose, and therefore has higher osmotic pressure. Now, glucose is way bigger than NaCl, okay? And however, 1 mole of glucose will have less osmotic pressure than 1 mole of NaCl. And that's because we said osmotic pressure has to do with the number and not the size. So even though we have a bigger molecule over here, we have more smaller particles, and therefore they will have higher osmotic pressure than glucose. Okay, so now let's try to elaborate.
In that case, glucose also has like carbon, hydrogen, and oxygen, right? So
Yes, but
it will also have more number of particles.
Yeah, but when you put it in water, it will stay as a glucose molecule. However, when you put NaCl in water, it will become two ions, Na plus and Cl minus. And therefore, 1 mole of NaCl will become two particles in water, and therefore 2 osmoles, because there's more particles, double the particles.
Okay.
We'll explain this in a diagram in a bit, okay? But now this is another very important concept, which is hypertonic versus hypotonic. For the rest of the lecture, I'll be using these terms, so it's important to know what they mean. Hypertonic is a solution with high osmotic pressure. So does that mean it has high amount of solutes or low amount of solutes?
Hi.
Hi.
High amount of solutes, okay? And then obviously, what would hypotonic mean?
No solute concentration.
Has
Less
low
solute and
solute
water.
concentration or low osmotic pressure. Okay, so you need to understand that this is a relative term. If I give you one solution, you can't say this is hypertonic or hypotonic. You can't, because you're not comparing it to anything else. In order for me to say something is hypertonic or hypotonic, it needs to be compared to something else, okay? So I'm saying hyper means more, hypo means less. So can you say something is more tonic if you're not comparing it with anything else? More tonic than what? It doesn't make sense, huh? So when I'm comparing two solutions, then I can say one is hypertonic and the other is hypotonic. But if I'm talking about one solution, you can't comment on the tonicity. Is that point clear?
Yes.
Okay. And then this is very important. Water will always move from hypotonic to hypertonic solution. You see, this concept is repeated again and again and again. And this tells you that it's very important. Okay. First, we said that water moves. We said that water moves from high water concentration to low water concentration. And then we said water will move from low solute concentration to high solute concentration, which is basically saying the same thing. And then we said that water moves to the area with higher osmotic pressure. And then again, we said that water moves from hypotonic to hypertonic. So it's very important to understand this concept, okay? Now, these are two solutions. You can see that this one has less solutes than this one. So we say this is hypotonic compared to this one, and this is hypertonic compared to this one, okay? So where will water move? From left to right or right to left?
Left to right.
From left to right. Why? Because water moves from hypotonic to hypertonic solution. Is everyone clear with this point? If you have any questions, please ask.
I had a question that's maybe a little not related. Is osmotic pressure going to be more is there going to be more osmotic movement than diffusion of particles? Because I know that particles will tend to move away from areas with high concentration, and water will
See,
also.
okay, so that would be the normal case if it was if there was no barrier. But in the body, we always have barriers between compartments. And these barriers are only permeable to water and not solutes. So
Okay.
if the body wants to equilibrate the tonicity, it will not move particles because those barriers are not, they don't allow solutes to move, but they only allowed water. So water will move instead of the solutes. But you're right. If there was no barrier, then the solutes will move to the area of lower concentration. But in the body, only water will move. Okay.
Perfect. Thanks.
Okay. So as you said, it will move from left to right or hypotonic to hypertonic. If you understand this part of the lecture, you pretty much got it. So now this is a pop quiz. A cell was equilibrated at 300 milliosmoles of glucose. I'll give you a hint, focus with the units, okay? And is then placed in 300 millimoles of NaCl. In which direction will the water move and what change would happen to the cell? I'll give you a minute to think about it.
It's not mentioned which is outside and which is inside.
Sorry, can you say that again? I didn't hear you well.
I think it's not mentioned whether they're placed inside the cell or outside the cell.
It depends on which one is inside the cell and which one's outside the cell.
Yeah.
So when I say the cell is equilibrated, I mean that خلاص, inside the cell it became this, and then you placed it in a solution that has this. So this would be outside this. So the
okay.
NaCl is outside and the glucose is this, basically. We have a lot of C's in the chat. Does anyone have a different answer? We have a B. Okay. Another B. C. Okay. So I see most of you picked C, but some picked B. Okay, can anyone explain why it would be C or B?
I think it would be C because we said it was 300 milliosmoles of glucose and then 300 millimoles of NaCl, which would make it 600 milliosmoles outside the cell.
And
So
why
that
is that?
means because
Why
we
is it
have
600?
both sodium and chloride. So the osmolarity is going to be much higher. And if we have more particles outside the cell, the water is going to want to move outside.
Excellent. Does anyone have a different answer? So the people who put D or B, why do you disagree with what he said?
No, I have a question about why is it lies or is it shrink? It's obvious that it's from inside to outside, but how do I differentiate between if it's lies or
Okay, I'll explain that in a bit, but at least you get the concept of inside to outside. That's very good. Okay, so indeed the correct answer was C, inside to outside, and then shrink. Why is it inside to outside? So the cell was equilibrated at 300 milliosmoles of glucose. Okay, so now the cell is at 300 milliosmoles, and then you placed it in a solution with 300 millimoles of NaCl. And we said mole is osmolality and not osmolarity. So in order to convert it to osmoles, we need to see how many particles it will become when it's put in a solution. And NaCl becomes 2 particles. So we will double the number. It will become 600 milliosmoles. And then water will move from low osmolarity to high osmolarity. In other words, hypotonic to hypertonic. And this is the direction of water, movement of water. Okay, so from inside to outside. So that's the first part of the answer. The second part, this is the diagram you have in your slides. This is a cell, okay, equilibrated at this solution. If it's placed in an isotonic solution, nothing will change. Okay, now if it's placed in a hypertonic solution, which is the case in our we placed it in a hypertonic solution, water will move from outside to inside, and therefore the cell will shrink because you're moving a lot of volume from inside to outside. Is that point clear?
I still didn't understand why does the solute move from hypo to hyper and not from hyper to hypo.
So that's just the law, the rule. That's just how nature works. And water always tends to move from a hypotonic solution to a hypertonic solution. So if you leave water by itself, that's what it will do. Okay, you just need to understand it.
So
However,
does that mean in a hypotonic solution the solute concentration is low?
I didn't quite hear what you said. Can you type in the chat, because I think there's a problem with the mic.
So I have a question. When it's hypotonic, that means that there's more solute inside, which mean and less solute outside, should make the water go inside the cell and making it swell, right?
Yes, and eventually, if too much water is moving in, the cell will burst. It's like a
Okay.
balloon. If you fill it too much, it will burst, صح?
So
Same
when he
thing.
says hypotonic, he's referring to the outside of the cell is hypotonic to the
Yes,
inside of the cell, right?
yes, yes. For the who asked, I think Alia, it was. Is this point clear? Why it shrinks or lyses? Okay,
No,
so I have a question.
can you go over it again?
Okay, so this cell is equilibrated at this much solute. Okay, you can see inside the cell. Okay, if it's placed in a hypertonic solution, we said water will move from inside to outside, صح? And because a lot of volume is moving from inside to outside, the cell will become smaller in size. However, if we place the cell in a hypotonic solution and water starts moving from outside to inside, if the cell becomes too filled with water, it will eventually burst or lyse. Lyse means burst.
All clear now.
Okay, thank you. So I have a question for you guys. If the question said 300 milliosmoles of glucose is placed in 300 milliosmoles of NaCl, then what will the answer be?
change.
Isotonic, nothing.
Exactly, nothing will change. None of these options are correct. So you guys got the hang of it, mashallah. So now let's move on to the next. Now these slides are also not important, and he's never tested about it before, and you'll never use it in medicine again, at least not in first year. Okay. So I'm not skipping slides. I'm just highlighting the ones that are important and are probably going to be asked about. Now this is a very important slide, and it's asked about a lot. Okay, you need to memorize these numbers. Okay. These are IV fluids. Do you know what IV fluids are? Intravenous fluids. They're placed in the blood directly. Okay. So 5% dextrose solution is isotonic. So if you give someone a 5% dextrose solution, it's always isotonic. Okay. We also have another solution called Ringer's lactate solution. It's also
Do we need to
isotonic.
know?
And
Do we
zero.
need to know? معلش رجعت كلام بس do we need to know what these things are like dextrose
You don't need to know what they are, but you need to know that 5% of dextrose is isotonic. It's very important. Okay.
Okay, thank you.
And then 0.9% NaCl, which is also called saline, is isotonic. Now, anything above or below these numbers is, if I tell you 10% dextrose solution, then it's hypertonic. Okay. If I tell you 2% dextrose solution, then it's hypotonic. And the same applies for the saline. If I have less saline and less NaCl, 0.9%, then it's hypotonic. If I have 3%, then it's hypertonic. And why knowing these numbers is so important? They'll ask you in the exam. A patient was given 0.9% saline solution. What happens, or what changes happen to the body fluids, or where will water move? And then what will your answer be?
No change.
No change. Water will not move because it's isotonic. And then they may ask you if he was given 0.45% saline solution, which is hypotonic, then what will your answer be? There will be a movement of water in the akhir, okay? Because you change the tonicity, and we'll touch upon this point in a bit. Okay, but you need to understand these, you need to memorize these numbers. 5% dextrose is isotonic, 0.9% of saline is isotonic, and Ginger's lactate solution is isotonic. Now anything above 5% for dextrose will be hypertonic, and everything under will be hypotonic. Anything above 0.9% will be hypertonic, and anything under 0.9% will be hypotonic. Okay.
Wait, can we go back to the last slide? Yes. What if he asks about Ringer's lactate? Is there
It's
going to be a
always
question
isotope.
on that? It's always out. Okay.
Yeah, and I've never seen a question on this, so I chose to include it just in case.
Okay,
Dextrose
perfect.
and saline are the most important.
Yes, thank you.
I have a question about the previous slide.
Hi.
Yeah, it's hypotonic, hypertonic, or isotonic relative to the intracellular fluid, right?
Yes, excellent. And yeah, I'll explain it in a bit.
Okay.
But you are correct. Okay. So now we'll talk about the most high yield part of the lecture. And if he asks you one question about this lecture, it's going to be about this. Okay. So it's very important to understand this. And this is just an application of what you know. Okay. So this is called a Datet diagram. The y-axis represents osmolarity, and the x-axis represents volume. The right side of the graph represents ECF. The left side of the graph represents ICF, and obviously ICF is more than ECF because, as we know, ICF has more fluid than ECF. So, okay. So any changes in the vertical dimension relate to osmolarity. Okay, so any changes up or down will be a change in osmolarity. And any change in the horizontal dimension relate to volume. So anything, any changes right or left, that means the volume changed. Okay, this is very important to understand. So do you guys understand this point? So if the graph moved up, that means I increased osmolarity. If the graph moved down, then that means I decreased osmolarity. And if it moves to the right on this side, that means I increased volume in the ECF. If it moves to here in this side, that means I increased the volume of ICF. So is this point clear?
Yes.
So now these are a couple of rules you should remember while solving these questions. The first rule is that any changes or disturbances will happen to the ECF. Okay, so most of the questions will be about disturbances. So they'll tell you he lost fluid, he gained fluid, we gave him an IV fluid, he ate salt. All of these changes happen to the ECF, because when you give an intravenous fluid, where are you giving it? To the blood, and blood is part of ECF. So if you're ingesting a salt tablet, where will that go? To the ECF. If you're losing sweat, from where will you lose it? From the ECF. So all disturbances happen to the ECF. Okay, water will not move from the ICF to the ECF unless there's a change in osmolarity of the ECF. Okay, and when we're solving questions, you'll understand why those rules are so important. Yeah, so just keep them in mind for now. Now, addition of hypertonic solution will cause a hypertonic ECF, because you're adding a hypertonic solution means it has more solute. So you're adding more solute to the ECF, and that will increase the ECF's osmolarity and causing a hypertonic ECF. Okay, addition of hypotonic solution will cause a hypotonic ECF, because you're adding a lot of water that has less solute than ICF, and eventually the ECF will have lower osmolarity than the ICF. All right, is this point clear?
Yes.
Okay, now loss of hypertonic solution will have the opposite effect of adding hypertonic solution, which is hypotonic ECF, because you're losing a lot of water that has a lot of solutes, and therefore you're leaving behind a hypotonic ECF. Okay, and loss of hypotonic solution will lead to an hypertonic ECF. Now, I don't want you to memorize this, because if you memorize it, you'll get lost. Hypertonic, hypotonic, you'll get lost. I just want you to understand it. If you're adding hypertonic solution, which has a lot of solute, then you're causing a hypertonic ECF. And why ECF, not ICF? Because we said that any changes or disturbances will happen to the ECF, not the ICF. You can't access the ICF. You're only access to the ECF, okay? And then the same goes for addition of hypotonic solution. And when you lose something, you leave behind the opposite thing. So if you lose hypertonic, then you leave behind a hypotonic. If you lose hypotonic, then you leave behind a hypertonic. Yeah. So this is very important. You guys get this point?
Yes.
Okay. And then you have to know that water moves from hypotonic to hypertonic solution. So 10th time in this lecture, water moves from hypotonic to hypertonic solution. Please don't get mixed up. It's easy to mix it up. And then if you mix up this, you'll get the whole question. Okay? Water will always move from hypotonic to hypertonic solution. Is that clear?
Yes.
So now let's try applying this knowledge on the graph or the diagram. Okay, so this is just a normal diagram. Okay, so now the first scenario is addition of isotonic solution. Okay, so I want you guys to solve this. You added isotonic solution. So will there be a change in osmolarity?
Change in volume only.
Only
So
volume.
for,
ECF.
yes, of
ECF.
ECF. That's important. Okay, so no change in osmolarity. So the graph won't move up or down. So it will continue in the same level. صح? And then you're adding solution, and where are you adding it?
ECF.
To
ECF.
Volume of ECF increases, and therefore this is the final graph, صح? And will water? Why is there no movement of water from ECF to ICF? You're adding fluid.
Just large.
Yeah, so
Osmolarity
go
is
back
same.
to this rule. Water will not move unless there's a change in osmolarity. Okay. So since there's no change in osmolarity, خلاص. There's no compensation. There's no movement of water. So this is the final graph. Okay. So this is simple. Isotonic is simple enough. Okay. So now let's talk about the next scenario, which is loss of isotonic solution. Now, is there a change in osmolarity?
No.
No.
change in osmolarity.
No.
And what happens to the volume?
It decreases.
The ECF volume decreases.
Only ECF. Will there be a change in ICF's volume?
No.
No.
Because there's no change in osmolarity. Perfect. So you got those two. Well, those two are easy. So now let's get to the hard stuff. It's not hard with any. Maybe I get a bit confusing. Loss of hypotonic solution. Now, when they say مثلا loss of sweat, they're mostly meaning it's a hypotonic solution. Okay, so losing sweat is an example of losing hypotonic solution. Okay, so now let's go step by step. First, let's think about osmolarity. Okay, so you lost hypotonic fluid. From where did you lose it?
From the
ECF.
ECF.
Yeah.
ECF. Okay, and what happened to the osmolarity?
It leaves
decreases.
behind an hypertonic solution.
Hypertonic solution. And so does the graph move up or down?
I think it moves up.
Is up.
Up to the
Does
up
everyone
to the
agree?
left. Yeah, I think the volume of ECF
Yeah.
decreases and the osmolarity increases.
Okay, so let's take it step by step. So we said that osmolarity increases. Okay, we all agree because we lost hypotonic solution, so it leaves behind a hypertonic solution. So this is where the new graph will be. Now let's talk about the volume of the ECF. So what happens to the volume of the ECF?
It decrease.
No, I think it increases because ICF will move to the ECF because there was a rule saying that the ICF moves to the ECF if there's a change in osmolarity.
Stays the same, right?
Okay. Okay, so those 3 points are all valid. So one person said that you're losing fluid from the ECF, then the volume of ECF should decrease. Then the other person said that since now ECF is hypertonic, water will move from hypotonic solution to hypertonic solution, and therefore ECF volume will increase. And then the third person said that since you're decreasing it first and then you're increasing it, then it should stay the same. So all of those points are very valid. All of you are thinking well. But the correct one is the first person who said that it will decrease. Okay. The rule says that if you lose solution from the ECF, then by default, the volume of the ECF will decrease. Even if then you got fluid from the ICF, it won't compensate for the amount that you lost in sweat. Okay? Because in the end, you lost fluid. So the total fluid in the end should be less than what it used to be. Okay, so the net change in volume in the ECF is it will decrease. And this is a rule you should follow. If I told you loss of solution, خلاص, by default, the ECF decrease. Don't get confused. Don't say, oh, now volume will move from the ICF to the ECF, so ECF should increase or be the same as the original. No. By default, I'll draw a line that goes down. Okay? If I told you loss of solution, always خلاص, ECF will decrease because there will be a net loss. Even though it will gain volume from the ICF later on, it's still not enough to return it back to original or exceed what it was before. Is this point clear? I think this is the most confusing part of this lecture.
Yes.
But is it clear now?
Yes.
Okay. So now we know why the volume of ECF decreased, because we lost fluid. And the osmolarity increased. Now, will the volume of ICF change?
Yes, it'll
Yes,
become smaller, decrease.
It won't change.
It will change. It won't change?
It will change.
It will change.
Yes, it will change. Because the rule says that water will not move from the ICF to the ECF unless there's a change in osmolarity. So now we do have the change in osmolarity. So definitely water will move. Okay? Bilal, is this point clear?
Yeah, sorry. Yeah, it is clear.
Now we need to know where it moves to. We said that ECF is now hyperosmotic, so water will move from the ICF to the ECF because water moves from hypotonic solutions to hypertonic solutions. Okay? And then this is the final graph. Now this needs a lot of practice. You won't get it 100% from now, or at least you won't know if you got it 100% because we're doing it together. So you guys need to do all of these scenarios alone without looking and checking if you got the correct answer in the end or not. Okay? You have to. Now, let's talk about the second scenario, which is ingestion of salt tablets. So first of all, let's see what happened to osmolarity. Okay? So what happens to osmolarity?
Osmolarity of ECF increases.
Increases.
Osmolarity will increase. Why? Because
the
you're
ECF.
adding more solute to the ECF. Okay?
Yes.
Like ECF osmolarity increases. Now,
And the ICF fluids will go towards the ECF because it has a higher solute concentration. So it will decrease in the ICF. The fluid.
You're 100% correct. So let's take it step by step. The ECF osmolarity increases because you took a lot of salts, and that affects the ECF. Okay? And taking salt tablets is not really adding or losing any solution, صح? So right now we're at the same volume of ECF. We didn't change the volume, we only changed the osmolarity. Now what happens? Will water move from the ICF to the ECF or ECF to ICF?
ICF to ECF.
Because water moves from hypotonic to hypertonic solution. And now ECF volume increases and ICF volume decreases. Okay? Is this graph clear?
Yes.
But I have a
Any
question.
confusions, anyone?
How come this time we added the increase in volume to the ECF, and the other example we didn't add the increase in volume?
Okay.
The example
Because
before.
last time, okay, that's a very good question. Last time we lost fluid. We actually lost fluid from the ECF. Okay, and therefore the volume decreased. But if you realize this time there is no loss in fluid, we just added salt. We didn't add fluid or lose fluid, but we only added solute. And therefore, after we ate the salt tablets, the volume didn't change. It's still here, but then water moves from the ICF to the ECF, and obviously if water moved and you're at the original level, then it's got to increase. Huh?
Okay, thank you.
Clear, everyone?
Yes.
Okay. Let's move on to the next scenario. Oh, you weren't supposed to see this. Okay, primary adrenal insufficiency. Okay, so you didn't take this yet, so I don't expect you to know what it is. It's basically aldosterone deficiency. And the normal function of aldosterone is that it retains salt and water, and therefore the deficiency of aldosterone will cause loss of a lot of fluid and salt, and therefore in the end, you're losing hypertonic fluid. That's what they're trying to say. Okay, so I won't go into detail of what aldosterone does. I think it's too advanced for you guys right now. So just know that this example means loss of hypertonic fluid. Because aldosterone, what it does, it goes to the kidney and it stops salt and water from leaving. It brings it back to the body. So if you don't have aldosterone, then you're letting a lot of salt of water and water leave in urine, and therefore you're losing hypertonic fluid because you're losing salt and water. Okay, so that's basically it. So let's work from here, from loss of hypertonic fluid. Let's go step by step. Does anyone want to solve this alone, step by step?
Okay.
So first of all, let's talk about osmolarity. What happens to the osmolarity of ECF if you're losing
So
hypertonic fluid?
we lose hypertonic, we have reduced osmolarity or decreased
That's one
osmolarity.
point. Excellent. ECF osmolarity decreases. Okay. Then what?
So the extracellular fluid is hypotonic to the intracellular fluid. So fluid moves from the ECF to the ICF. So we have an increase in the volume of ICF and decrease in the volume of ECF.
Excellent. Does everyone understand that?
I would have a question. It says
Yeah.
will cause loss of fluid and salt. How do you know? Like if it was to lose the concentration of solute to the fluid itself is like equivalent in terms of that, and the osmolarity wouldn't change. So how do I know how much of the fluid is lost and how much of the salt is lost? I don't know if my question's clear or not.
Yeah, it is clear. So you mean maybe you're losing just enough salt for it to be isotonic, for example?
Yeah.
The main source of salt retention is aldosterone. So if you don't have aldosterone, you're losing most of the salt. So you're definitely losing hypertonic fluid, definitely. Okay, so you'll understand this more once you understand the function of aldosterone. But just know for now that if you don't have aldosterone, then you're losing almost all the salt and the fluid. You're losing a lot of salt and fluid.
I have another
Okay.
question.
Go ahead.
What about a hemorrhage? What is it categorized as?
I guess it's also loss of hypertonic fluid. So I'm not sure honestly, because that's not one of the scenarios you guys need to know. But aslan, once you have like an acute hemorrhage, the last thing you'll be worried about is the movement of water.
Yeah, okay.
So is this example clear for everyone? So all of you need to know how to draw this alone. All of these scenarios I'm giving you right now. Okay. So try it alone without looking and then check with the slide. Okay, go ahead.
When we say we're losing hypertonic fluid, it means we're losing both salts and water, but more salts, correct?
Yes.
Okay, thank you.
More salt compared to the ICF. So we're losing. Okay, so now let's move on to the next example. Syndrome of inappropriate ADH release. I have no idea why they're giving you guys this, because we just took it this year. I didn't know what this was before this year, second year. So it's basically excess ADH. So what ADH does is that it retains water without salt. Just retains water.
Okay, is this antidiuretic hormone?
Yes, it's antidiuretic hormone. So as we said, the function is that it retains water. So if it retains water without salt, then it's gain of hypotonic fluid. Okay.
So the ECF will increase the volume of ECF.
Okay, so now let's talk about osmolarity first. So what happens to the osmolarity of the ECF if you're gaining hypotonic fluid?
Decreases.
Decreases. Excellent. And then what happens to volume?
The volume of ECF will increase.
ECF increases.
Why is it increasing?
Because we're retaining fluid.
Because we have excess of ADH.
Okay, and then what happens?
Compensation from hypo to hyper, from ECF to ICF.
Okay, so in the end, we'll have this.
I think yes.
And the person who asked earlier why don't we have decreased ECF volume since water is moving from here to here? Do you understand now? I don't know who it was. Anyways, so even though water is moving from the ECF to the ICF because it's hypotonic to hypertonic, we still have an increase in volume. Why? Because the net is the gain of hypertonic fluid. Whenever there's gain, خلاص, ECF will increase على طول. Whenever there's loss, ECF will decrease. Okay? So this was the last example. I'll send out in your batch group, inshallah, more practice questions, not only on this, but on the previous concepts as well. And I'll send out the answers as well. So make sure you solve them. Okay? For this lecture, it's mainly practice questions. You need to practice a lot to get the concept. And this lecture is not only important for this lecture itself. The concepts will be repeated again and again in many lectures and in many blocks. CVP, renal, GI, endo, you name it. Okay? So now let's talk about the last concept, edema. I'll not talk about this a lot because it wasn't really explained in your lecture. It was just touched upon. So edema is an abnormal increase in volume of interstitial fluid, which is the space between the capillaries and the tissue cells, okay? And this may be due to many causes that have to do with something we call the Starling forces or lymphatic system. And this is to be continued in CVP. I won't explain anything more. I just put it in case they ask you what is edema. It's just an abnormal increase in the volume of interstitial fluid. So it will cause a swelling. Okay?
Okay.
Can you explain? So this is the end of the lecture. So anyone have any questions?
Can you send slides in the group, please?
Of course. I'll send it soon. So Maya is asking, can you explain how vomiting is isotonic? Okay, so sweat, vomiting, fever. They say that fever and sweat, I mean the sweat caused due to fever and just sweating in general is hypotonic. They just measured the salt concentration in sweat and they saw that it's hypotonic compared in comparison to ICF, and same thing goes with vomiting. It's probably just because you're not losing any salt with vomiting, so it's just losing fluid. Because even if you ate salt and you vomited it out, so you didn't change anything in the body because it wasn't ingested in the first place. Any more questions? Yes, it won't cause any change in osmolarity since it's isotonic. So if there are no more questions, that's it for me. If you have any questions, you can always text me. You have my number at the beginning of the slides. And good luck.
Thank you very much.